Thank you so much for staying with us. The World Health Organization and the International Labour Organization, ILO, have issued new recommendations to address mental health issues among the working population as the world marks Mental Health Day. WHO and ILO stated that an estimated 12 billion workdays are lost annually due to depression and anxiety, costing the global economy nearly $1 trillion. Hence, more action is needed to tackle mental health issues at work. The UN Health Agency recommends manager training to build their capacity to prevent stressful work environments and respond to workers' needs. Well, joining me this hour on the news is clinical psychologist and autism specialist, Dr. Jessica Taiwo. Thank you so much for being here with us.
Good afternoon. How are you doing today?
I'm great. Thank you for joining us. Let's go straight into it. I'd like to start by looking at the staggering figures around mental health. Now, WHO says around 11 people per 100,000 per year die by suicide in Africa. Now, that's higher than global average of 9 per 100,000 people. So what can be done to tackle these increasing cases?
I think the reason why we have increasing cases in Africa is mainly because, in our culture and society, it's not normal to reach out for assistance when you're going through specific things. If you're not feeling well, you can go to the pharmacy and get medication. If your car is not working, you can go to the mechanic to get it repaired. But when it comes to psychological or mental issues, it's not typical for us to reach out to a therapist or psychologist for help. Because we'd be seen as, someone that's unstable, someone that's crazy, et cetera. So it limits people's ability to reach out for support when they're going through certain things.
All right. What help do the adolescent and younger generation need to be mentally fit and contribute their quota in their society?
In regards to the younger generation, I think it has a lot to do with social media. Social media has become a part of everyday life. And oftentimes that doesn't attribute to good social well-being, because the internet shows you what you're supposed to look like, what you're supposed to do, and the things that you're meant to have. But the thing is, that's not all what life is about. So if our generation can look into more things versus comparing ourselves to social media, it would help a lot with our social well-being and our overall, wellness and the way we think and feel about ourselves.
All right, Dr. Jessica, let's take a look at this year's theme, which is make mental health and well-being for all a global priority. Now, how can this theme be made a reality as opposed to just mere words, especially by employers and African governments?
I think when we talk about a global priority, I mean, babies have to get immunizations and people have to get vaccinations like we did for COVID. So mental health should be something that should be a global priority. It should be something that should be addressed in all facets, even in young children, all the way to adults. It should be made something that employers should look into, ensuring that the mental health and the wellness of their staff is okay, down to, even the staff that work with you at home. Mental health is a priority everywhere else in the world, and it's high time that we in Africa make it something that's a priority for us because it's affecting so many of us in so many ways.
Clinical psychologist and autism specialist, Dr. Jessica Taiwo, thank you for joining us in the news.
Thank you so much. Thank you for having me.
All right.